Wyandotte County has one of the highest fetal and infant mortality rates in Kansas. At one time, the Black infant mortality rate was one of the highest in the nation. So we received some grants to help us implement a fetal and infant mortality review board, which we did starting in 2013. And that fetal and infant mortality review board consists of mainly three sections. That's the case review team, where charts are abstracted, there's a maternal interview done, and then recommendations are made to the community action team. And then the community action team takes those recommendations and hopes to implement evidence-based interventions in the community. The third thing is really awareness. I think a lot of people in the county really didn't know that fetal and infant deaths were such an issue. So the third thing, awareness, is through our pregnancy and infant loss group that we do, and then really support for families, which we do through the annual vigil we have. Every fetal and infant death is reviewed. So we look at the chart, we talk to the mom about her situation, specifically what barriers she faced in receiving prenatal care, getting to her appointments. There's a lot of questions about stress and home life and resources. So when we look at each case, we're looking for connections. Wyandotte County has been awesome from the beginning, from the first press release. We had several people that have stepped up to serve on the case review team. That is doctors, nurses, community members, mental health, parents as teachers, who all come together every quarter to look at each case and make recommendations. Then the community action team has even more members, even far-reaching into the community. For example, like the public library, the school system, things that are not typically thought of as medical, more social service, really people who are invested in making a difference.